Assalamualaikum and a very good evening to Miss Kuzaima binti Bari. My name is Muhammad Ashraf Faikal bin Raj Anand. My matrix number is 36 DUP20 F1107. Today I'm going to present about how to prevent depression among students. Firstly, what is depression? Depression is also known as major depressive disorder. Is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is treatable. Depression causes feelings of sadness or a loss of interest in activities you once enjoyed. It can lead you to a variety of emotional and physical problems and can decrease your ability to function at work and at home. The symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for a diagnosis of depression. The cause of depression is there are several possible causes of depression. They can range from biological to circumstantial. The common causes include family history. You are at a high risk for developing depression if you have a family history or depression of another mood disorder. Next is early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. Last but not least, the brain structure. There is a greater risk for depression if the frontal lobe of your brain is less active. Next is how to avoid depression. Firstly, avoid stress. It is not always possible to avoid stress, but taking steps to do so may help. These include getting enough sleep and rest, learning to say no to additional demands, I don't know. Taking breaks from work. Other than that, you must do some exercise. Research shows that physical activity can act as an antidepressant, and experts encourage doctors to include it as a treatment. Last but not least, the conclusion. Depression is one of the most common conditions in primary care, but it is often unrecognized, undiagnosed, and untreated. That is why depression has a high rate of morbidity and mortality when left untreated. Most patients suffering from depression do not complain of feeling depressed, but rather than anhedonia or vague unexplained symptoms, all physicians should remain alert to effectively screen for depression in their patients. There are several screening tools for depression that are effective and feasible in primary care settings. Arigato, thank you.